So Dr. Herrera was talking about you, and I looked at your CT scan that you brought.
Yeah, so she said you were looking at that.
Yeah, I really appreciate you bringing that to us. It's pretty evident what's going on there with the lymph node in your neck and really kind of the mass, the left base of the tongue.
How big is the mass?
The lymph node is probably about 2.5, maybe 2.2 centimeters in size. And then the mass, the base of the tongue, I didn't really measure.
Centimeters, that's right.
About an inch or so. The mass probably is about an inch across as well, too. Very lateralized over there on the left base of tongue. So, have you not seen it?
Yes, right here.
Yeah.
Okay. Yeah, I can. No, I mean the CT scan.
Yeah, we didn't understand it real, but we
Did,
yeah.
did they send you all of this stuff too? I know I brought the disc.
She had everything.
Yeah, I got the disc. I got the report. I have the pathology.
Okay, I just want to make sure.
And
I wasn't sure if I was supposed to give that whole folder to you.
Yeah, no, I think for the most part, all the info we pretty much need we have.
Okay.
Are you a smoker by any chance?
Mm-hmm.
Okay.
He chewed cigars for 5 or 6 years.
Okay, all right. And just very briefly,
Wine.
Wine?
1 to 2 glasses of wine.
Awesome.
At least every
What's
day.
your wine of choice? Your Cabernet?
Merlot. Cabernet, yeah, I've changed the Cabernet lately.
All right, not allergic to any medicines, never had radiation, chemotherapy before?
No, sir.
Okay.
And he's currently on no medications whatsoever.
Okay, all right. Let me get you to have a seat over here if you don't mind, sir. Take a feel of your neck and that lymph node there. What kind of cards do you work on? Any at all?
Anything and everything.
Okay. You have your own business or?
Yeah.
Yes, sir. 40 years of it.
Okay. Can you work on cars too?
Not really.
Not really.
I can answer some questions on the telephone.
On the telephone.
Look a few things up on the computer, but.
Do cars have solenoids anymore now?
Oh,
yeah.
Okay. What is a solenoid?
That's what, well, there's more than one, but usually it goes with the starter. There's one on the starter.
Oh, yeah.
Switch.
And Ford has them on the firewall.
Okay, why are you doing that? Is it hurting?
Well, I'm thinking it might.
You anticipate
He grabbed me by the throat down there. I don't know what happened.
Just trying to grab that muscle there and feel along the internal jugular vein there, make it so we don't feel anything. Okay. Take a look at. Do you have a dentist?
Yes. I just left there.
You just left there.
Yeah. I kind of need to get some trays made for my teeth.
Okay.
That's correct.
That is correct. Who you been talking with? Who's doing my job?
Dr. Herrera told us that he would probably want us to do that.
Wow.
Because we're ready to get this ball rolling.
Get rolling, huh?
Mm-hmm.
Okay. Let me look in there and see what's going on. Huh?
Maybe some bigger ones.
Yeah, well, I don't know if the inside of them are kind of weird or something. Kind of, it's like my hands are wet, but they aren't.
Yeah, they're probably not the powder kind that used to have.
What's going on with these? They've had some budget cuts. This one feels like it's going to go on fine. So
yeah, that one.
You
had a dud.
Yeah. What accent you got? You're from out of Georgia?
Say again?
You got a little bit of
an accent?
Southern
I've
accent?
never really, I'm from Tallahassee, which I guess could be
yeah.
But,
Tallahassee's almost like Alabama.
Right there.
From northwestern. They have a little bit of a southern draw to it.
Okay. I've never known that to be the case. Ooh, okay. Chin down just a little bit. We got a lot of metal in here. Open real wide.
It's got some implants and some caps from root canals and
Real wide. Oh. Okay, stick your tongue out at me. Okay. Alright, open real wide again. Oh yeah. Okay. Show me your hand. Okay. Good. Okay.
bunch of money in that mouth, isn't there?
Yeah. When the radiation hits metal, it scatters and then deposits dose. It's really kind of how radiation is produced. You have electrons that are accelerated towards a metal target. Those electrons hit the target and X-rays are then produced. You know, when the X-rays basically hit metal, they produce secondary X-rays, and that in turn, for you, with respect to your mouth, gets some scatter radiation throughout the mouth and gives you some blisters and discomfort along the tongue there. I'm going to give you a squirt here. So, not the mouth, in the nose there, big squirt. Just sniff this back. Okay, and then one more. Yum. So, no, don't blow it out. Just sniff it back.
You get a lot in there.
Yeah.
More than the other
So, anyway, as those X-rays hit those fillings, we'll get some scatter.
we can't aim away from it. It's right there.
Yeah, I'll explain all of that here in just a bit. I'll explain all that here in just a bit as to why we don't just treat the spot where it is and why the field has to be bigger. But the posterior aspect of your mouth is going to get some radiation treatment. As those X-rays hit those fillings, you'll get dose deposition over on the buccal mucosa, inner portions of your cheek, and along the sides of your tongue. We likely will need to fashion something with respect to like a wax covering or coating to put over. You haven't had fluoride trays yet. Made yet, right?
They're making them now.
You're making them.
They already did the implant.
Okay.
Are you telling me something different?
Well, no, you need the trays, but let me go get Pam real quick. Okay, you're coming to get me for. Okay. Give me 1 second. Tell Pam to come here just for a second. What was the name of that wax stuff that we used to fabricate for the other head and neck patient the other day? He's got some pretty extensive fillings in there, which, you know, what we did the last time actually.
Yesterday.
Yeah, but I was going to see if his dentist had something
Okay,
that
let me,
we could actually make where he'd come in.
it's a silicone mixture.
Okay.
It's two that when you rub it together, it's a silicone. Let me see if I can get the exact, because that would be best.
Yeah, because that worked really, really, really well. They're going to interrupt me for a procedure. Let me go run and get them started, and I'm going to come back. I'm going to scope you, and then I'm going to be away for about 7 or 8 minutes, but I'll be right back, okay?
All right, thanks, Doctor.